hello, good morning, good evening, wherever you are in the world. I'm Rita McGrath, a professor at Columbia Business School, coming to you virtually from Princeton, New Jersey. And my guest this week on our Fireside Chat is Charlotte Jones Burton. A friend, I guess I'd say, a participant, yes. A colleague, wonderful speaker, and founder of a wonderful organization called Women of Color in Pharma. So we'll be talking a little bit about her journey and anything else that she feels like covering in this forum. Okay, so I guess starting off, maybe we begin with just tell us a little bit about your story and how you got to be where you are, which is a pretty impressive place.
Well, thank you. And I would like to thank you for the opportunity to be here and have this fireside chat with you and your audience. And, you know, I could start in so many places. I really wanted to focus on my professional story, but in order to focus there, I think you have to understand a little bit about the seed that was planted in me when I was very young. And it came from, that seed was planted from my mother, who was a single mother raising a daughter in southern United States in Arkansas.
Oh, wow.
And she really, yes. And she instilled, you didn't know that, so you're learning things. Yeah. She really instilled in me the notion that I should think big and dream big. And that even though we lived in a small rural town in Arkansas where many of the people live below the poverty line, that I shouldn't allow my environment to dictate who I am and what I do. So I bring that with me in everything that I do. And she also, I believe, instilled in me to really challenge the status quo. She told me from a very young age that I would be a physician and that the things that I would do would matter in the world. So take that and now fast forward to the physician that I am. And I, did my medical training at University of Maryland School of Medicine. And I decided that I wanted to be a nephrologist because I wanted to impact my community, which I knew by that time was impacted disproportionately with diseases such as hypertension and diabetes. And then I learned that those were the number 1 and 2 causes of end-stage renal disease, and really why many African Americans are on dialysis. So I wanted to make a difference as it relates to healthcare disparities. And,
so that started really young. So just for our audience who may not know, maybe you should just give us a little primer on what nephrology is, because some people don't know what that is.
That's a good point. So nephrology is the study of your kidneys. So the kidneys, we have 2 of them, and they're very smart organs and very important to help us maintain our balance of water and salt in the world. And also to help us excrete waste that come into our bodies. So our kidneys are really important.
Thank you.
So I decided that I wanted to be a nephrologist. I did all of my training, as I mentioned. I was on the faculty at University of Maryland. I was NIH funded doing research and really started to focus more on clinical research, and decided that I was caring for patients, focusing on kidney research, but I couldn't do all things well. And so I decided that I did want to go down the path of clinical research. And that is the thing that led me into the pharmaceutical industry, which is where I am now. It was that notion of think big, dream big, do something that matters, and have a broad impact. So I really wanted to impact not just the patients that I saw in my practice early on, but I wanted to impact a broader scale of patients. And I wanted to devote my career to clinical research. So that's really how I landed in the pharmaceutical industry.
And that must have been a bit of a shock to the system, though. I mean, I've worked with pharma a long time, and it is pretty unusual among industries.
Well, I didn't get the memo that the pharmaceutical industry was corporate America. I missed that memo. And so you can imagine that it did take me a while to really figure out where I was. In fact, I landed at a great company that was doing really great work in cardiovascular disease. I got a chance to work on some really big projects, but I always, when I came in, I was looking for someone to really help me understand how to succeed. And it was very difficult for me to find that person. And I would say that my story, if you will, is really a result of me being resilient, me identifying individuals that could help me. Some of them actually came to me and helped me. But those first 4 years of being in the industry were very challenging for me.
Well, and I think one of the things that is very difficult for anyone who's from an underrepresented group is, you see this wall of pictures, right? I remember when I was doing my doctoral program, we used to have this wall at Wharton, and it was all pale males, right? You know what I mean? We used to call it the Hall of the Great White Male. But it's just hard when you don't see yourself represented in those groups.
That's very true. And I always say you have to, you can't be what you don't see. And that's a quote from Marian Wright Edelman. And that is definitely true. And within the walls, it was difficult to find people who look like me. And in fact, that's the story and the experience of many women in this industry. And in order for me to really find my way and to begin to be what I would call successful, so that I could impact others, I really had to create that network so that I could really come into what I was expected to do. If you go back so many years to that seed that my mother planted inside of me.
So how did you get from Arkansas to Maryland?
Well, it's a little bit of a story. I mentioned my mother was a single mother, and she was very bold in herself in her own right. But I ended up, she left Arkansas and we moved to Ohio, Shaker Heights, Ohio, when I was the age of 13. And so I did my middle school and high school years in Ohio. Went to a boarding school and really did well there. And then went to Washington University in St. Louis, which is where I became pre-med, worked at the medical campus and graduated, and then went to Maryland from there.
Great. That's great. Wow. That's just amazing, that breakthrough story. So one of the things that you've been, working on for a long time is this whole issue of equity and justice in medicine, medical care. I mean, among many other places, but you've just published a paper, I note. Got my exhibit A here, looking at, and the paper is called Improving Health Equity for Black Communities in the Face of Coronavirus Disease 2019. And I wonder if you could just sort of summarize either that paper or your perspective on what the issues are and then what can we do about them?
Yeah. So, one of the things that COVID-19 has unearthed is that there are differences in terms of underlying comorbidities, such as, and by that what I mean are diseases that individuals have and different populations have. And so we've known for many years, as I mentioned, I've been writing about healthcare disparities since I was at the University of Maryland, which is, I won't date myself, but that was decades. That was decades ago.
That's okay.
And so now I think more people are focused on that and trying to understand why is it when you have a virus such as the coronavirus that we're dealing with, why is it that different communities, different populations are exposed to it and have a greater risk. And we know now that Black and Hispanic populations are dying at greater numbers than whites, for example. And when we begin to think about the underlying diseases and why is it that some races have a different proportion of diseases, we also need to talk about social determinants of health. And what that means is that the places where we live, where we receive our education, where we work, really does impact our health. and the stressors that comes along with those different environments, that impacts our health. And so there's now this focus, this renewed focus on that. And so one of the things that the paper really talks about is brings that to life, but also brings to life what we need to do in terms of what are some of the solutions for us if we want to improve equity, because it's really the health of one population, as we're seeing, really does impact all of us. And, you know, just concretely by that, what I mean is if the health of Black populations is impacting with this virus, and they work and they help, you know, are on the front lines, and you're exposed, then that means that you could also, your health might also be impacted. So it really does require that we all work on this together. And as I mentioned, it's not just health, it's also education, it's also environment. So there are many different sectors that are involved, and there's a lot of work for every sector to do.
Yeah, one of the most interesting stories along those lines to me is years ago in the New York City public health system, they found that kids were being persistently readmitted with chronic respiratory problems. And when they dug into it, when the physicians there dug into it, what they found was that these kids lived basically in housing with mold, and that the mold was, you know, even though they'd go to the hospital, they'd get better, they'd be sent home back into these situations. So what they actually had to do at the Department of Health was they had hired a legal team to bring lawsuits against landlords to get the substandard housing fixed so that these kids wouldn't continually be readmitted. And I just think it's an interesting example of how so many of these systems intersect in ways that we don't necessarily think about.
Absolutely. It's very interconnected. And I think that's a perfect example. Another example that may be well known to the audience is the water that has lead in the water in Flint, Michigan, and other cities as well. Flint is not the only city. And the impact that that has over years for the families who are exposed to that and the children who are exposed to that.
Absolutely. So what are some things that can be done? I mean, one of the things I was very surprised at, and I should say a little bit about how we met. So Charlotte and I met when I was hired by her then employer, Bristol Myers Squibb, to run a program that started off as like a little 3-day program. Let's do something for women. And then the CEO got really involved, and it became oh my God, the CEO is really behind this program. And it turned into this just massive investment in women and people of color in general, underrepresented groups, with a desire to really bring more diverse voices into the discussion. But one of the things that just I had not ever even thought about before joining with BMS was just the disparity in clinical trials. You know, I mean, the only people well represented in clinical trials are typically white males in, you know, urban areas, or more urban areas, more developed areas, I'd say. And so not as many women. So we know very little, you know, relatively little about women, and very few people of color. And I thought that was so interesting, because if you peel back and you look at where do clinical trials happen, and for those that aren't sort of part of this vocabulary, clinical trial is what you have to do to get a drug approved. And it's a very involved process. And, you know, when you think about, well, where do doctors work, and where are hospitals located, and who's physically in an accessible place to participate in a trial? And, you know, I think it's just, you know, again, it's back to this systemic idea.
Absolutely. And just to speak a little bit about that, I think it's important to understand that it's complex. It's not just one reason why we see that women or people of color are underrepresented in clinical trials. And the notion of we all have a responsibility to play as we want to support that. And the reason why we want to make sure that we have representation in clinical trials is because our purpose and our goal as we develop medicines, as you've mentioned, which is the purpose of why we do clinical trials, is we want to make sure that they're safe and that they're effective for all people, not just white males. And therefore, having the representation in our clinical trials where we're studying the medicines is of importance. And, one of the things that I've learned in my career is that me being a part of programs brings a unique perspective. And it brings with that unique perspective, by nature of who I am, the focus on women, the focus on people of color, and making sure that we have scientists who look like the people that we want to include in the clinical trials is really important. And it's important to have that along, as you've mentioned, it's a long runway to the development of a medicine. And therefore we must start at the beginning as we are discovering medicines, making sure that we have scientists who are representative of the populations that we want to treat. And along each aspect of that, it's important. So I thank you for the work that you do in terms of the women in leadership programs that you're doing, because it's important to also have women like myself, people of color like myself, in leadership positions. And that matters as it relates to who we then include in clinical trials. We're not where we want to be, and we have a way to go, but I'm optimistic now that we're having the conversations, and by having leaders like myself involved in the industry, that will also bring about what we're looking for as it relates to equity in clinical trials.
That's so important. So one of the interesting things I've always wondered is if you do come into a situation where the sort of group in power is fairly homogenous and they're not like you, are there any advantages that gives you?
I like how you said that. So, that's interesting. And I thought about this, this notion of, what would the advantage be? And I think that it depends, is what I'll say. It depends on if the group in power is open to including people who are not in power or do not look like or have the status that group has, their willingness and wanting, do they really want to see a change? And are they willing to engage in conversations that sometimes are difficult conversations, to really understand the perspective and see the opportunities? And so when you have that, I would say absolutely there's an advantage to being a unique voice in the room. I would also say that it helps that when you are in the room and you are that unique person, that you understand your value, that you come to the table knowing that you have value and that you're able to articulate that and use your voice. And I spend a lot of time helping other women, women of color who look like myself, and even those who don't, understand their value, understand their unique perspective, and being able to have the courage and confidence to voice their perspective so that we can, as we've mentioned, realize the mission of our industry and the mission that's really within our hearts.
One of the things I talk a lot about in my research and also teaching is the importance of diverse perspectives. And I don't mean that in a politically correct way. I mean, like really people that come from different places, different educational backgrounds, different awarenesses, because it's really hard to see your own blind spots. And I'm bumping up against this every day now, and it's humbling, the things that you just don't know, right?
And we all have blind spots. And I think that's why it's important for us to all seek to understand and be able to listen and be educated. And when we do that, I truly believe that we will achieve something greater than if we had a homogenous group of people in a room trying to figure out how to solve the world's ills.
Well, it reminds me of some research that my dear colleague, the late Kathy Phillips, did. And, the problem with real life is that you never know what the right answer is, right? I mean, you can do all the things right and come up with, and then you bump up against COVID-19 and you're a hotel, right? I mean, you can have bad outcomes even if you do everything right. And you can be awful, stupid, vicious, terrible, horrible, and come up with a success. So in real life, you just never know unambiguously what the answer is. But in an experiment, in a lab, you can know. And so what Kathy did was she set up an experiment where different kinds of groups were forced to confront a creative problem-solving task. And what she found was the homogenous groups did a lot worse on the task and felt a lot better about it. They felt it was amazing. It was great because we all got right down to business. We spoke the same language. We didn't have any friction. It was just, but they did worse. They just came up with fewer alternatives. They had less choice. There was less variance in the results that they had. The diverse groups, on the other hand, felt terrible. It was like, oh my God, I had no idea where that person was coming from. I had to work so hard to figure out what their motivation was, and yet when they really got down to work, their range of options was much better. The richness of their solutions was much deeper. And I think we often forget that. And so one of the things that's always led me to wonder is, so all those highly homogeneous senior level teams are probably feeling pretty good about the decisions that they're making. And yet we don't know.
They're confident.
So it really is very, very, very interesting. So another project we did together came around the founding of your group, Women of Color in Pharma, which you co-founded. I'd just love to hear the story of where that came from and sort of its journey to where it is now, because it's had a big impact.
Well, thank you for that. And you've been with us from the beginning, I would say. So I would also thank you for that. And so the story, and I did allude to it earlier, really it came from my journey within the pharmaceutical industry. And I mentioned that I didn't get the memo. And when I landed, there wasn't a group of people there to really tell me
it wasn't like a welcome thing, with a band.
It wasn't. And so, about the first 4 years, it took me a moment to figure it out. But then I started to meet other women who were just like me and felt isolated. And many of them, to my surprise, had been in the industry a lot longer. And so go back to what my mother said, what you're doing matters, challenges the status quo. So I decided that I would pull a couple of these women together in my home and we would just have a conversation. And honestly, I don't just have conversations. We workshopped around the idea of how has your experience been in the industry? And, so we worked through this workshop and we got to the end. And what we realized was that it wasn't just what I was feeling, other women were feeling this as well. And so you know what that meant for someone who was raised to think big and dream big. That meant that we obviously needed to do something about it. And what we decided to do was form an organization called Women of Color in Pharma. And that was in 2015. And now fast forward in 2020. And I do believe that we are having an impact. We have been focused on the individuals and around the empowerment of individuals to seek the development that they need, such as we mentioned the women in leadership programs that you offer. We've been offering coaching and programming to really help women. We're focused on Black and Latino women, understand their story, understand their value so that they can then have roles of impact in this industry. We have also now, as COVID and the social injustices that we're seeing in the world have been highlighted, and we're thinking about what is our responsibility as an industry and how do we advance equity in the industry. We've now started to really offer our thought leadership to the industry and partnering with the industry in a way that will help us advance equity. So not just reach racial and gender equality in senior levels and in the boardrooms, but also advancing equity in every aspect of the business. And we believe that that is in line with the mission of each of the companies in our industry. We spend you know, all of our energy and all of our time thinking of innovative ways in which to bring medicines and devices to patients who are battling chronic and very serious diseases. And it's not one sector of patient. It's not just the wealthy patient. It's not the white patient. It's not the male patient. It really is all patients. And so that's what we have been doing now as an organization is really partnering with companies, partnering with, and what we hope to see is more partnership with trade associations so that we can lead the effort of advancing equity.
And what's you have an annual conference, I mean, or did until this current crisis. What are some of the themes that you have in the back of your mind as you're doing the programming for those conferences?
Mm-hmm. So, and we're now building our next conference, which is coming up this November 5th through the 8th. And we have taken the approach of thinking about what's timely and what's relevant. So one of the things that this conference will focus on is partnerships. We've seen a lot of public-private partnerships as we are trying to identify therapeutics and vaccines for COVID-19. So we thought we would highlight that. Another thing that we are going to be talking about, and you've mentioned it here, is inclusion in clinical trials. And what does that look like? What does it mean? And how do we, in our business and each of our companies, how might we go about doing that? There are some companies that do that well, and then there are others that still have some work to do.
Mm-hmm. And do you bring those together?
And we bring those together, yes. Okay. And then we also highlight the personal aspects. So self-care is very important for us to be successful. And now we've been thrown into our homes where the intersection of our home life and our work life, and even for those who have young kids, which I don't have a young child, but the school has now come into the home as well. How do we deal with that?
I'm a hairdresser, by the way. So if this professor thing doesn't work out, I have a fallback option.
So all of those things are things that we highlight and things that we put programming around, as you've mentioned. We most recently, at the beginning of COVID-19, we most recently had a panel of physicians talking to the women in the network about COVID-19. What are some of the myths that we heard? That was very early on. What were some of these physicians experiencing on the front lines? And it was the first time that our women had a chance to really sit and talk about COVID-19 to a group of physicians. So that was really something that we offered. We've also done virtual workouts and bringing that to our members, really to remind them that you have to take care of your whole self. And
put your own mask on first, right?
That's exactly right.
Were there any really surprising things that came out of that conversation with the physicians?
I think one of the surprising things that came out for the women who listened is that this was a new virus, and these physicians were learning as they go. And a lot of things that they talked about, they borrowed from diseases and viruses that they've treated before, but really we were learning about COVID-19, and that was very early. That was in March when we had that. And now, fast forward, and you can even see when you watch TV, the change and how it's evolved based upon what we know now and the number of cases. And there's still a lot that we don't know. We're just learning that children are affected by this virus. We're just learning that, teenagers and young adults can get the disease. So there have been many myths along the way, but it's really been because of this is a new virus, and we are learning about it. So I think that was the number one impression from that. I think too, we talked about, there was early on this myth that Black people couldn't get COVID-19.
What?
I know you said you're just learning. That was
Really?
an
That was a
early
myth?
myth. That was an early myth.
And
So then
why would that be?
and so it's unclear the origin of that myth, but I can tell you that on social media, and even our audience, there were people who thought that. And I remember at the time, Idris Elba had just come out and said that he had COVID-19, and we made the point, and those physicians made the point that that's a myth, it's not true, and don't believe it. And so it's important to make sure that we are addressing those myths. We're working with the communities and increasing the education and awareness within communities. And that goes back to the paper that you talked about, that I had the opportunity to author or co-author. It's really important that we have people who look like those that they're trying to educate and make aware, so that when there are things that pop up like that myth, they can be dispelled immediately, because the health, our health is impacted by that.
So we had a question from one of our viewers about the partnerships, the public-private partnerships, and how might they have a positive impact on inequality?
So I think it's important, and we talked a little bit about diversity of thought. So one way is that when you have different people coming from different perspectives trying to solve a problem, that it really helps in terms of the innovation that may come up and getting to solutions. I think another way is the resources, right? So not all public entities have resources that private entities have, and vice versa. We're seeing now that the government might have some resources that they are using to help accelerate, and whether those resources are money or they are adding more scientists to look at this, or removing red tape that exists. Because all of those things matter, particularly when we're talking about drug development, and it can take upwards of years to decades to develop something like a vaccine. So those partnerships, as it relates to COVID-19, will help us, and hopefully we're trying to we, the public, would like to see a vaccine almost, in months. Like, we would like to take the timeline from decades down to years, down to months. And so those are just some of the ways in which these partnerships can help.
Could you just, for our listeners who may not know, describe just what steps it takes to produce a vaccine? Because I think another one of these myths is Einstein goes into the laboratory and fills a test tube and lightning comes out, and and then boom, the problem's solved. And the reality is not really like that. So maybe just give us a little primer on what it takes.
Yes, and so not just a vaccine, but medicines.
Medicine
takes
in general, yeah.
Multiple phases. There's the discovery phase, which is really the preclinical before we go into humans. There's that phase of discovering
sort of how long does
a
that
target.
Take?
And so that depends. It depends on if it starts in an academic institution, if it starts at but that could take 10 to 11 to 12 years, for example. And then once we get into humans, there are 3 phases that we go through. There's phase 1, where we're looking at the asset in healthy volunteers to make sure that it's safe. We start out by giving 1 dose, and then we give multiple doses, and we can increase those doses, but it's very controlled, and we are looking at the safety in healthy volunteers. And then once we've identified that it's safe in healthy volunteers, then we move on to people who have the disease. And we want to, again, look at the safety first in smaller studies, look at how we are, look at different doses. as well, and then try to identify a dose that we think is safe, that we can then test in a much larger population, and those are phase 3 trials. So the first in human trials are phase 1. We're learning about the pharmacokinetics of the medicine, meaning, once the medicine gets in the body, how much it's exposed in the blood, if you will, how is it metabolized, all of those things in phase 1. Phase 2, we're looking at in actually patients who have the disease. We're looking at doses that can be tolerated. What's the best dose that still keeps patients safe? And then we go into larger populations in phase 3. And not only do we continue to look at the safety, but then we're looking at, does the medicine work in terms of the effectiveness of it? And all of those phases are required for us to then submit the application to different health agencies, regulatory agencies throughout the world to get the medicine approved. So it is a long process, but for a good reason.
Well, yeah, because, if a drug goes wrong, that can be potentially devastating. And we've seen examples where, something that worked in a clinical trial size population, when it gets out into the general population, has unintended consequences or unintended side effects that nobody was really expecting.
Absolutely. And that's an important point, is that even though drugs get approved, we still continue to monitor and look at the use in the real world.
Mm-hmm. So I wanted to go back to the question of community, because I think that's so important. One of my concerns is, how do you tell truth from fiction? So many people live on social media and, they believe what somebody said on the internet. And it's so hard to stamp those things out, right? But I think with respect to one of the things I learned first working with, at the time it was BMS, is the lack of trust. That you representing corporate America, big pharma, whatever, like, why should I trust what you say when you're coming into my community, you're a stranger? Like, why should I put my faith in you? And, there's been a very spotty history of institutions and minority communities. So how can we bridge that? I think maybe WOCIP has some ideas about that, and you probably have other thoughts.
Yeah, absolutely. So I think it's important to recognize that to bridge that, it requires leveraging resources that are available, and by that, what I mean, identifying who the trusted partners are. Mm-hmm. And the role that WOCIP plays in that is, if we ensure that we have women of color who are in roles of leadership, who are also within roles that they might interact with the community, it helps to bridge that. If we have partnerships with community organizations or community businesses, then that goes a long way in bridging that trust and having the communication and the dialogue. Because how do we gain trust? It comes through relationship. And it comes through the communication and the dialogue. It doesn't just happen by me coming in and telling, regardless of what color I am, me coming in and telling you this is what I have. I have this great thing that's going to help you. No, that's not how it happens. And all communities, people of all races, trust is built. And it happens through relationship and partnership. And so I think that we just have to recognize that that's why it's important to work on those things. It's not just writing a check, or, like I said, just coming in saying, I have this that will help you. Now do what I say.
Right. And you don't just talk about this, though. You've got your own sort of side, aside from your, presidency of WOCIP and your fairly significant senior role at Otsuka. You've also got this side business with your husband, I believe, and yes. and another community business around health and welfare. Could you tell us a little bit about that?
Yeah, so you've done your homework.
I have.
And what I would say, What I would say is that my husband, who's been my husband for 25 years, has been a partner, a great partner in life, as well as in our home as we've parented a child, and also in business. And, we really have identified what our values are, and we've worked in the community along the way. And certainly when our son was in school, we worked together within our community to really further the things that were important as it related to education and the education of our son. And we've now, over the past 4 or 5 years, really thought about how can we continue to serve our communities in a way that honors our values of health and wellness, of family. And we identified a business, and we're now partners in that business, and we own 2 indoor cycling studios. And what I'm most proud of about the 2 businesses is the business model, and it utilizes community giving as a way of marketing, so kind of cause marketing through community giving. And that was one of the things that attracted us about the businesses that we own, which is called Cycle Bar for any of the avid indoor cyclists. So we're going through a rough patch now, obviously, with COVID-19, but it's been, we are very passionate about the work that we do, and this notion of having organizations come in who want to raise money, and at the same time being able to do something that's related to health and wellness in order to do that. It's something that gives us great honor to be the business owners of a business like that.
That's fabulous. That's great. So one of the people I've heard from, a professional married woman, is Indra Nooyi, the former CEO of Pepsi. And she was being interviewed on TV, and the interviewer said to her, well, how do you set your priorities in life? And she said, well, if you were to ask my husband, right, he would say, oh, your list? It's Pepsi, 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 the kids, your mother, me, and like everything else. And her response to him was, well, look, at least you made the list. I thought that was just perfect. But I think all of us have had to kind of navigate that sort of how do you manage to support each other, in what's for many of us a lot of new territory. For a lot of we don't have a lot of role models. We don't have a lot of, wise people to turn to. So when I hit that fork in the road, what did you do? So have you got any advice on the navigating sort of partnership models for folks?
So one of the things that we've done over our 25 years, and we've now done it in our business as well, is it's important to understand your strengths and play to your strengths. And by that, I mean, I'm a visionary, and my husband is very detail oriented, and the operations is really his thing. So when we're trying to solve a problem or work together, it's important to really know that, to know that and leverage that. So that has helped us. And I think also the communication has really helped us. Wanting to sit down and listen. And I've mentioned a lot of these principles that we use: listening, seeking to understanding, assuming good intention. Mm-hmm. These are all things that have been really important as we've navigated our partnership. And then to also say when things are not going the right way, or, if they don't feel right. I'm an intuitive leader. So if it's not feeling right, to really just say that. And I may not have any evidence, but by me just saying that and him acknowledging it, we can then move the needle and try to figure out together where we go. So I think those 2 things are really important. One, understanding your strengths and leveraging them. And then 2, the communication.
Mm-hmm. Yeah, I find a lot of couples, when you get stressed, there's a tendency to sort of not be willing to grapple with the fact that things may not be rosy, and may not be for a little while. You're saying that, though, made me really think about leadership. And one of the questions that comes up with the Women in Leadership program that I run, and also other venues, is our model for leadership. And I would say that our conventional ideas about leadership were premised on kind of steady state situations, more or less, right? Where you could sort of see what the goal was. You get up on your horse with your sword, and you're like, follow me. And, and it's sort of, that's the image that sort of, I think a lot of people have of leaders. And yet in an uncertain situation where creative approach is needed, where you've got to make it up because there are no data, right? That kind of leadership, in my research, it suggests that's just like, you do not want that kind of leadership in that kind of situation. So have you seen the models for leadership evolving as you've had a fairly long career now? Have you seen that change?
Well, I think that one of the things that I've learned from you is the importance to be, as a leader, to be open and agile. And, you wrote a book about it, indeed, right? And even now, the times that we're living in, you're talking about steady state. And it's like, when's the last time have we seen a steady state? I don't think that we've seen steady state. And so, where I'm left is to really think about the characteristics that we have to rely upon as leaders. And I read an article yesterday by Ella Bell, and I was so enthralled. And the thing, what's top of mind is that there were 3 qualities that she mentioned: grit, influence, and there was one other. I think it was grace, was the third, that are so important for leaders to have. And just think about grit. I mean, it's so important during uncertain times to really have that. And I think there are others. It's not just those 3. It's important to have creativity and resilience. I think that those are important characteristics of leaders, because there really isn't this steady state that we might all hope for. But there's going to always be something, and we have to evolve with it. And those are the best businesses are the ones that have leaders that are able to evolve. Mm-hmm. That's what I would say, but you're the expert, Rita.
Well, I think we are really looking towards a different model for leadership. And in the book, I talk about leaders. There was an old article back in the 80s where the authors were categorizing different kinds of leaders, and they had the collaborative leader and the upfront leader and the charismatic leader, and then they had this category they couldn't figure out, and so they just stuck it in the box and said, well, we don't know what this is all about, and they called them the Crested Leaders, or growth-oriented leaders. And what these leaders did was what Linda Hill has talked about, which is they're sort of leading by they're offering the guardrails, and yet within those guardrails they're sort of letting people release their slices of genius, is how she puts it, which I think is a beautiful phrase. Just for those of you who don't know, Ella Bell's a professor at Dartmouth, buddy of mine, really wonderful woman. You can only imagine what being a woman of color in a place like Hanover, New Hampshire is like. She came to one of our programs once in New York, and she said she just reduced the diversity quotient of her town by 50%. She's just so upfront about it all. It's just amazing. But she is really worth looking into. So it's Ella Bell of Dartmouth, and a very prolific author, writer, observer, and so forth. So we've got a few minutes left, and I thought what would be really fun would be to have you give some advice to the you of maybe 25 years ago, when you were just getting married and just embarking. If you could kind of go back and say, gee, I wish I'd known that then, what might some of those things be?
So one of the things that has taken me a while to realize that I would really tell my younger self would be to figure out what matters, so that you can do what matters and focus on that. In a world where we can do so many things and there's a lot of competition for our time, although the past 5 months we may not have felt that way, or we've been able to kind of be home and in an environment where we're not traveling and going to all the different activities. But I do think it's important to figure out what matters so that you can minimize the distraction, so that you can have the most impact. The other thing that I would tell myself is to not play small to people around me. And in a world where you may be working in a pale-dominated culture, as you've mentioned, pale male-dominated culture, you could play small. And what does that look like? That looks like just deciding not to have that conversation, or just deciding when you go into a meeting room, to sit on the sidelines and not be present, not offer your experience or your opinion. So I think that that's the second thing that I would tell myself, is to not play small and to show up in a way that would allow me to bring value to everything that I do. And there are certainly times in my early career where I didn't do that. And there are even times now where I have to, that voice inside my head, I have to talk to myself and really say, you could not say something right now, but that would be you playing small. And so you have to kind of do that work to be able to articulate whatever it is that you're trying to articulate. And then I think the third thing that I would tell myself is to have courage and not be afraid of failing. I would say that to myself. And then the final thing that I think I would tell my younger self is to have fun. Is to really just have fun. Don't take it all too serious.
I think that's a great point. So if people want to learn more, so, a lot of the folks tap into these because, it's an area they don't have a normal exposure to. They want to learn more. They want to get smarter. They want to get involved. Is there a way they could, for example, support WOCIP or get involved in any of your programming? I know you're doing a big think tank, right? That's coming up.
Yes, so we did that actually.
Oh, you did it? It's already happened.
Yes, we did
that.
How did that go? Already happened at the end of July. It was an amazing program. We had 10 sponsor companies, over 80 people in attendance, and you really had to be a part of a company that sponsored in order to attend. But we had, 15 experts from places like McKinsey and Korn Ferry. We had women of color who were actually in the industry who were speaking. We had our partner vendors, Center for Workforce Excellence and Inside Edge, who helped put on the program. And it was a day of learning, a day of really sitting in the truth, I would say. Understanding that we haven't been as intentional, we as an industry hasn't been as intentional as it relates to race and gender equality, and also as it relates to advancing equity in our clinical trials, for example, and that there's more to do. But I'm optimistic. We had 2 CEOs, my CEO at Otsuka, Kabir Nath, and then a CEO at Bluebird Bio, Nick Leshy, who we had a conversation with. And they offered, they both gave so much of themselves. They were authentic, and they talked about their vision for change. Then you have CEOs talking about their vision for change and wanting to advance equity through the work that they are doing in their companies. And so that left me with such great optimism in terms of where we can get to as an industry. So that was a great program.
Fabulous. So other places people could learn more or get involved or get smarter?
Absolutely. So they can, I'm certainly on LinkedIn. I'm on Twitter,
okay.
Instagram. My handle is DocCJB Inspires. Our organization website is WOCIP.org for WOCIP.org. And on LinkedIn, they can just find me by Dr. Charlotte Jones Burton.
There you go. And well worth a visit. Well, I just can't express enough. I know it took a long time to get this moment to happen. It's been such a pleasure to have a chance to converse with you. And I can't thank you enough.
Well, thank you. It's been wonderful talking to you. That hour flew by. And I look forward to partnering with you in the future.
Absolutely. Thank you, Charlotte.
Thank you.
Bye, everybody.